Hello, I'm Dr Elisabeth Coyne, and I'm going to present Supporting Family in Health Adversity in a Digital World. I work at Griffith University in Australia, but I also sit as an adjunct associate professor at the University of Southern Denmark, where I work closely with my colleague, Professor Karen Deprevink. So in this presentation, I'm just going to explore family strengths and what we know about the family. We also want to look at the influence of digital communication and how that's changed over the last few years, and link family strength of communication to the patient and family outcomes, and look for recommendations on how to maintain human connection in a digital world. So the first thing to look at is, who is family? And one of the things that we really have to look at is the family is who the family actually say. So this is people that are closely supporting one another. There's emotional ties. There's also a strong sense of belonging to the family. There's a commitment to being involved in each other's lives. But really the main thing is they actually call themselves family. And so this may include aunts and uncles. It may also be their closest neighbour who is part of their family and eats meals with them regularly and helps support them. We also need to think about the different life stages and the different needs of each of these stages with young children, adolescents, in older adults, or when in that sort of age where you're supporting your elderly parents. We also need to look at the differences and the different influences of the different family members. This is really important when you're actually working with family, to think about who is the leader, who's the person that finds the information, who may be the person that would be the appropriate to go to if there's cultural influences. And to really look at sort of what are the strengths within this family, as these will influence the functioning of the family. So you can see some aspects of different families, how if they've got really strong bonds and strong communication, they're often more likely to ask for help. And it's sort of, family isn't whose blood you carry, but it's whose love and who loves you back. So family is actually really important for overall health outcomes. It has a really strong influence on the different members within the family, because it helps them to understand what each other needs, helps them to find where that information is, to access it, and it really helps the family's ability to maintain functioning. And so this is really important to think of when you're dealing with a patient, that who is their family and what can you do to help the family support them. Families will often fail to seek help if they feel lost in the health system, and this is really important. So a family that often says, oh, we're doing okay, or we're sort of, there's no problems, are often the ones that just feel lost and they don't actually know where to seek help. So they're the ones that you need to be looking for. When you're looking particularly in the sort of family functioning in cancer, is that families will aim to work together with diagnosis. There's often a real sharing of roles, changing of roles, and particularly this is often sort of the case as different aspects of treatment, of who goes with mum to cancer treatment, who's there helping with extra meals, who might be picking up the children if they're younger family. But you've got to also remember is that not all families will deal constructively with change, and so this is really important. And one of the key aspects that research has found is that communication within the family is one of the main influencing factors to how well the family will actually focus and be able to understand information, and access support. So this leads you really to the importance of family assessment, because family assessment is the only way we can understand the family strengths. So who is the family? What are the different family members? And what differences do they bring? What strengths, what family strengths do they use? This is in relation to maybe communication styles. As the quotes there say, he didn't really talk to anyone. So this is that sense of if you're not sharing your distress, then how does anyone know how to actually help you manage that? And then sort of on the other side, that commitment to one another, that we were doing everything together, or we're always there for her, but in some families that may not be the case. And so understanding those family strengths is really important. We know from research that communication is a key aspect. And as the when you're looking at communication, it's the sharing of information between persons. It's very personal communication. It's very different from when we are actually, providing information as a lecture, or we're telling someone something. Communication is where it's a focus on having the other person understand. When we're looking then at that digital communication, we have to really be careful of how we're focusing then on that sort of understanding. Facial expressions, touch are lost in digital communications often. And so it's really important to think about how you're saying what you need to say. Are they able to understand that? How can you understand if they're understanding? And as the comment says there, it's not what you say, it's how you say it. So the influence of understanding communication really lies in simple factors of health literacy. And this is the person's ability to access and effectively understand and then action health information. And 1 in 2 adults often cannot do this adequately. And so when you think about this, that is a lot of patients and families that you talk to that really need information to be stepped out, assisted to understand the medical forms, assisted to understand the medications that they're taking. And then when you look at digital literacy, this is another step up. This is a person's ability to find, evaluate, and communicate information through digital resources. And the thing with evaluate is this is where, is this YouTube, is this website actually a appropriate one? Is it evidence-based? Or is it just someone's opinion? And this is really interesting when you're looking at patients' health literacy and digital literacy on what are they actually reading and understanding and how can they then action that. So the main thing when you're looking at communication in healthcare is that there's a lot of body language in what we as health professionals do, both the way we extend our information to others, but also on how we pick up if the patient's understanding, if they're able to action it. So we look at their body language of the patients. They look at our body language as the nurse. And we also need to be aware of that reflection on our own time to communicate. So when you're looking at a phone call, don't make it, if you're really wanting this person to understand this information, when you're busy and you're likely to be short, and not allow that person time to actually clearly communicate their concerns as you portraying and providing them with information. And really be aware of interrupting. So if a person is actually explaining something, if you interrupt, then they feel that what they're saying is not important. So being aware of that aspect on when you're communicating with others. Digital technology is really important for health professionals to now start engaging with. It means that information can be enhanced with links to videos or specific websites. We can have digital reminders or booking systems so that patients get that reminder or they can easily book themselves around their own timetable. It also has apps for health. So this is wellness, medications, fitness, mental health. There's a whole range. But one of the things that's important is to help your patient and your family members work out what suits them best, remembering that their own health and digital literacy may be lacking. We also know websites and videos and apps are really important, but they need to be appropriate. So helping the patient and the family find the right ones. In the health system, we have electronic records, medication charts. Most information is transferred digitally. And so this is really important that when you're actually a health professional, that you're clearly writing the information to the next person whom you won't be able to have that face-to-face conversation and understand if they're acknowledging what you're saying, need to be make sure your writing is really clear on that digital record. Wearable devices such as blood sugar, heart rate alarms, exercise prompts are really important. But we're not, as health professionals, really acknowledging the importance of that for the patient. And it'd be really interesting to sort of link into more of this wearable devices for patient-reported outcomes, as we're trying to tailor the information we provide for them in the short time they're actually visiting in hospital face-to-face with us. We also need to be, really sort of aware of robotics and telehealth. These are two aspects of digital technology which is really starting to change the way we deliver care. And it's important to embrace this, but also be aware of who it's being provided to, what support they might need. And I think this is really important to understand the influence. And so remembering the access to a range of tools. So this means they need to be able to have reliable internet. Do they have access to digital information? Do they have access to websites? Do they have access to telehealth? Do they have screens where they can actually engage in this face-to-face? Be aware of sort of extended information, language changes and visual aspects of understanding. So we know that if we're providing websites, can the language be changed? Can there be closed captions on a video? Can we video important information for patients and so they can watch it with family with closed captions, slow it down to ensure that understanding? If we're doing a telehealth, can we assist them so we can actually see their response? You also have to be aware of the equity of access. So this relates to literacy. Can they actually work their way through that online medical information form? Can they access that, the medication information that we're expecting them to read? Do they have internet? Is it reliable? And also the aspect of digital security needs to be really considered when we're starting to move more of patients' information into online health platforms and online sort of data where we're sharing it. So the advantages to digital technology is we can, in some ways, reduce equity of concerns or increase them depending on the internet access. So it's, when you're looking at medical forms, these are great and enables the patient and the family to fill them out at home. They don't need to come into hospital, but can they understand them? So really important as your first step of communication is to understand what the patient can actually do by themselves, what they feel comfortable with. At-home tools, apps and support can really improve that home management and ease of access for follow-up if you can access and link them in appropriately. So once again, making sure they understand it, they've got the right technology, they can link it and without being concerned. So sometimes if you're looking at sort of heart rate apps, make sure that the alarms are set appropriately, that they understand what this means. If they're patient-reported outcomes that are then coming back to you, that you explain that you'll be looking at them once a day, once a week, before they come in, so they understand the process. Telehealth really enables healthcare at home, but it does have barriers because there is sometimes a lack of connection. So really it'd be important to maybe sort of, how you can work this out with the patient. So what do they want? What do you want? What can be a great way to sort of have that access at home without them having to come in, but still having good follow-up care provided. One of the things is to recognise the challenges of digital communication. So we need to really be aware of who we're communicating with and can they understand it? Can we see their communication styles during the interplay? Have they got access to good internet, to good microphones? Have they got the ability to work through and understand how to sort of have the sound go louder or softer? Have they got an area they can actually use? Recognise the patient's understanding of health literacy and be really important to don't overestimate. Health professionals have been found to mainly overestimate the patient's understanding, mainly because patients are so helpful by saying yes, yes, yes to us. And so it's really important that we make sure that we clarify, maybe follow up, get them to explain back to us what we've just said. And this is even more challenging in the digital format, where patients might feel very shy in that first time of having their camera on. Making sure that you have access to the whole family. This is important because maybe it's the family members that can help mum access her doctor's appointment online. Communication to reduce hospitals' readmissions have been found that this is one of the key aspects. So if we can have patients further and closely understand what we are expecting them to do at home, we can really improve and reduce their readmission. And so readmission is defined as when a patient is discharged and then has subsequent unplanned or avoidable admission within 30 days. And it's linked to overall poorer outcomes. So when you think about this, if a patient has to come back into hospital within that 30 days, then they're likely to have long-term follow-up needs. And so it's really important in this first instance to really make sure that you're communicating clearly, that there's close follow-up within that 30 days, that they're understanding the information and the expectations of what they need to do to self-care and self-manage at home. And so avoiding readmissions using technical, like digital technology, is about helping the patients really engage with that information at home. And so we could have then information about medications, pain management, dressings, mobilisation, and we could have this that the family could re-watch it. We might also have it that it's a link to further websites or a link to actually putting in some patient data for us to follow up, and then have as an alarm that then sends out to have a follow-up phone call if the patient had not had good pain management or they had starting of nausea and other side effects. And so digital technology can really be used to benefit the patients at home care as long as it's followed up correctly. And one of the important things is that sort of communication and really listening is a key. And so really thinking about who we need to include at the family and delivered to the family's level of understanding. Need to identify who is how the family normally communicate and who's the key person. So this person might be the person that we call and they set up the face-to-face telehealth conversation, or they may be the person that gets sent the links to videos to help with self-care. And really explore how the family manage at home. So what would be best for them? Is it with the follow-up phone call? Would they like this in person? Would they like it with a screen? Do they want access to videos or online websites? And looking at recommendations is to really think about how we can embrace this new digital and advances in healthcare. So provide information in different formats. Be innovative how we can improve the delivery of information. So maybe looking at what you currently provide. Can it be provided also in digital format? What digital technology could be used? So is there an app that could be used to help you understand the mental health of your patient? Is there mindfulness apps that really might help this patient with their pain management that you could then give them the information for and they could then be using at home? And visualization and really helps the understanding of information and the retention of it. So, how can we visualize with technology the actual information that we're giving to patients? If we're talking about pain management, can we provide a lovely lot of photos as well of what their medications might look like, how to take them, what mindfulness looks like, and also assist the family with digital technology. So one of our my own research has really looked at video enhanced health education, and this is where we've developed a set of videos which have both simulation, narrative, and they're really aimed at basic health literacy levels. The videos can have closed captions, the language can be changed, and so can the speed of delivery. And the QR code there links to our website, which is a YouTube channel which has the videos for storage. And this is a great way where you might consider, either as a research project or as a clinician, that you can provide hospital-based education that really links to tailored education for your patient and their family. In conclusion, I'd just like to identify that different communication styles with the patient and family are part of that assessment that you need to include. You need to understand who are the key family members and what strengths this family brings to this conversation and this, this interaction, and allow time and think about sort of where you're actually going to have this communication. Is it going to be as telehealth, as face-to-face? Are you going to provide digital formats as well? And really maintain that connection with the patient and family through your whole interaction, really being careful of sort of that active listening and that you're listening and clarifying points as you're going through. And really provide the information across different formats to ensure really heightened understanding and actionability for the patient and family. And role model this style of communication for future generations of health professionals. So as you yourself develop your own ideas, make sure you're mentoring other health professionals and academics and students to ensure that the sort of our way of communication is really enhanced as we move into this digital world and looking at different ways to present information. Thank you. And the references. And lastly, I just really want to promote the International Family Nursing Conference, which is in Australia, in Perth, in 2025. So June 20th, please come to Perth. The abstracts are open now. Come, enjoy yourself. And this is Perth. Perth is a beautiful part of Australia. It has got vineyards, caves, really friendly native animals. You can have a reef, you can go snorkeling, watch beautiful sunsets. It's a lovely place to visit. And so please think about coming to our International Family Nursing Conference. Thank you.